All right, so for this last section for chapter 1, we're going to talk about anatomical terminology. And I really want to emphasize this particular part of chapter 1 because you are going to be using a lot of anatomical terminology. There's a lot of vocabulary in anatomy, there's a lot of terminology, and if you understand the roots, if you understand a lot of the basics of anatomical terminology, it will help you throughout the semester. So please, 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 please focus on the terminology and the vocabulary, especially different roots and whatnot, because there's a lot of information hiding in the names of things. There's a lot of information hiding in the terms we use, most of which are using Greek or Latin roots. So if you understand your Greek and Latin roots, it's going to make your life a lot easier. It won't make the class easy, but it will make it easier. So what are we going to focus on for this particular section, this last bit of chapter 1? We're going to talk about anatomical position. We're going to talk about directional and regional terms used to describe the human body. We're going to talk about 3 different planes that are used within the study of anatomy, and then talk about posterior and anterior body cavities, subdivisions, and organs we can find in each of these little areas. And then we're going to talk about the serous membrane and explain its function. So we want to focus on using the proper terminology because that's really going to allow us to properly communicate things. We're going to be more precise. If everybody's using the same vocabulary, we can eliminate errors, right? So that's the big thing that we want to take out with this class, is to prevent mistakes, to prevent miscommunications. So by using terminology that everyone is familiar with, right, that everyone, no matter which hospital you go to, which clinic, which particular field or subfield you're in, everyone has the same basic language. And that's really important, right? Because we're all working together as a team to help patients, right? Now these terms are made up of a few things. They're made up of roots, prefixes, and suffixes. So the root usually is referring to the organ, the tissue, or the condition, and then a prefix or a suffix is going to help describe the root. So if we look at our example here, hypertension, our root is tension. So we think tension, right? There's something going on there, right? Something's under tension, it's tight, right? So we're talking about pressure in this case. The prefix is hyper, right? Hyper, right? If someone's hyper, right? They're go, 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 go. So in a more specific way, we can describe hyper as high or over. So hypertension, high pressure. In this case, we're talking blood pressure, right? So we could also have hypotension, right, where blood pressure is too low. Hypo meaning below or under or low. So hypertension, high pressure, hypotension, low pressure. The root is the same in both. We're talking about the same concept, blood pressure in this case. The prefix, hyper versus hypo, describes what's going on with that blood pressure. Is it high? Is it low? Is it normal? Right, bam. So we really want to pay attention to the terms. Pay attention to your roots, pay attention to your prefixes and suffixes, because there's so much information hiding in there that if you just try to brute force memorize everything, it's going to be really difficult. But if you take some extra time, especially in the beginning, to kind of solidify this and kind of change your thinking about the terminology and the vocab, it will make your life easier in the long run. Right? So do please, please, please put in the time and effort to pay attention to the terminology, to break the terminology that we use down, because as we learn more and we build on top of this, right, we build on top of what we're learning, knowing your roots, your prefixes, and your suffixes is going to make it easier further down the road. And that's what we all want, let's be honest. We all want it to be easier later on. So now let's talk about anatomical position. Now when we are describing the body and where things are located or where things are facing, we are talking about it from the point of what we call anatomical position. This is a standard stance or a standard position of the body that we use so that whenever we're talking about something, because obviously our bodies are dynamic, we can move, right? You can move your arms, you can move your feet, you can turn things around, you can push something up or push something down, right, in your body. Like you can raise your arms, you can kick a leg out, right? You can have your hands facing palms forward or the backs of your hands facing forward, right? So if we're talking about position of body parts to each other, we have to have a standard position we're talking about because our bodies are dynamic. So let's take a peek at what anatomical position really is. So in order to be an anatomical position, the body is standing up, right? We're standing up, the feet are shoulder width apart and they're parallel. So our feet are flat on the ground, they're facing forward, right? Toes are facing forward. You're just kind of standing upright. The upper limbs, so the arms are at each side, so the arms are facing down, right? The hands face forward, so we see the palms, and then the face is looking straight ahead. So you're just kind of think about a generic person just standing up, looking straight at you. Legs are just straight down, toes facing you, palms facing you with the arms down. It's a very generic, very standard position. And we use this so that anytime we're describing the movement or the position of a body part compared to something else, we have that baseline, right? So we say something is distal or something is medial, or we're moving the body part in the form of adduction versus abduction, right? We're doing so with the anatomical position in mind. We're talking about it with the anatomical position in mind. If a body is laying down, we can refer to it as prone or supine. Prone means your face is down, so the face would be down against the floor. Supine, the person is laying on their back with their face up, right? So prone, we're talking about laying on your belly, right? Face down into the ground. Supine, laying on your back, face up towards the sky. And then there's a lot of different regions. Every region has its own term, and I know it looks like a lot, and it is in a way, but a lot of these terms are going to be helpful later on, especially when we get to certain organ systems like the skeletal system and the muscular system. These terms will help you so much, especially with those two systems. Take the time to study them now, because you will see them come back in some degree when we talk about those other two systems, for sure. Now, I'm not going to sit here and go through every single one of them, but we'll talk about at least a couple. That way we can get familiar with some of them. And I'll talk about some examples of where we see these terms come back. So, for example, oculus or ocular. We see oculus, that would be the eye. And so, let's say we're talking about the muscle that goes around the eye, orbicularis oculi, that would be a muscle that is around the eye. The oculi or oculus part of the name tells us the location, right? Mamma, right? So we think mammary gland. Where would you find the mammary gland? In the mammary region, which would be in the chest, right, or the breast area. Going down the digits, right, or the phalanges. Digits would be the fingers or toes, right? It's kind of a generic term, but let's say we're talking about extensor digitorum. That's a muscle that allows you to extend your digits, right? So it's going to be something we would see that allows you to straighten your fingers out, right? So those are just a couple examples, right? Or let's go one more. Let's say we're talking about the femur, and we talk about some of the blood vessels in this region. So you might hear femoral or femoral artery. You might hear it both ways. So the terms, the regions we're seeing here right now, we will see those come back later, right? We will talk about them and use the roots, right? These are, you can kind of think of these as your first set of roots. We'll see them come back. So we already mentioned like the femur being like the femur bone, right? But also like the femoral artery, right? The artery that runs in this femur region. Right? So super important that you take some time to get to know these terms because they're not going away anytime soon. And the sooner you practice them, the sooner you commit them to memory, the easier other components of this class will be. We also have directional terms. So the last slide was all just regions, like body parts. Now we're talking about direction. So where are we facing? So let's talk about on the left first. So we have the cranial direction, which is going to be the head. Caudal, we think tail, right? So that's going to be towards the buttocks. Posterior, also sometimes called dorsal, is going to be the back. And then anterior or ventral is going to be the front, right? The front side of the body. And again, we'll see these terms come back. So let's say we're talking about the tibialis anterior muscle. The tibialis anterior muscle is found in the tibia region, right? Down on the tibia, which is down in the shin area. It's kind of the bone that forms your shin. And then tibialis anterior tells us it's in the front, right? So the name alone, tibialis anterior, we have information on where to even find that muscle. This is why I want you to take the time to get to know these terms, because it will help you later on. We also have right and left. Now keep in mind, we're looking at this woman here, this female figure, and we see the right is on our left and the left is on our right. So it's important to note when we mention right and left, we're not talking about our right and left. We're talking about the right and left from the perspective of the person who owns the body we're talking about. So if you think about your own left and right, right? Your right's on your right. If someone's looking at you, your right looks like their left. So we're always talking about, when it comes to right and left, we're talking about from the perspective of the person's body, right? The person who owns that body. So if we're looking at an anterior view of a person, the right and left are always going to be swapped. That's a really important distinction to make, because we're going to be looking at organs and body parts from different angles, and you have to remember that we're using right and left from the perspective of the person who would own that body part. Because if you look at something from the front, you have left and right going one way. If you look at something from the back, your perspective of left and right is different. As when we look at it from the perspective of the person who owns the body part, right and left always stay the same. And that's really important that we keep that distinction, right? Because you wouldn't want to say left and right and then mix those up. Let's say if we're doing like, for example, a knee replacement surgery, and the person's right knee is supposed to be replaced, and you're looking at the body and go, oh, there's the right knee, it's actually their left and your right, and you do the reconstruction on the wrong knee. That doesn't happen very often, but it can happen, right? And that's why you see people double check it all the time, but it's super important that you keep in mind right and left are from the perspective of the body part, of the person who owns that body part, not from your perspective of left and right. We also have medial and lateral. Medial, we think medium or middle. Lateral, we think off to the side. So something is medial, we're saying we're closer to the midline. And if something's lateral, we're saying it's farther away from the midline. We also have distal and proximal, and you'll see we have this twice. This is focused on the limbs. Distal, we think you're in the distance from the torso. And proximal, you're in close proximity to the trunk, right, to the main part of the body. So like the hip would be proximal to the trunk compared to the foot, which is distal, right, it's further in the distance. Same relationship in the arm. The shoulder would be more proximal to the torso, whereas the hand would be distal because it's further down the limb. We also have 3 different planes of the body. Basically, this is if you were to cut the body into different views. So we can look at 3 different planes of the body. We're going to look at mainly the sagittal, the frontal, and the transverse plane. And this is basically when, if you were to take a cut of the human body, right? So if we are to cut right down between the eyes, all the way down the middle, that is a sagittal cut. Transverse would be if we cut in half, kind of like at the belly button, where we're dividing top and bottom half. And then frontal would be dividing the back from the front. So dorsal from ventral, or posterior versus anterior. That would be the frontal plane, sometimes called the coronal plane. Sagittal would help us divide left and right. Transverse plane would divide top and bottom. So if we look at one organ, let's say we're looking at the brain here and what this could look like. So if we take that frontal plane dividing front and back, right, this is what we would see. We see that sagittal cut dividing left and right. This is what we would see. If we did the transverse plane, right, we divided top from bottom, this is what we would see. And you can see these views are all very, very different. And so we do want to be familiar with what cut we're taking or what plane we're looking at, because that can change how something appears, right? Because we're looking at it from different angles. And some things we'll focus on, we'll use like a frontal plane for. Some things we'll focus on using a sagittal plane for. And actually a lot of things we'll probably just use a sagittal plane. But we could use any of these, right, depending on how we want to look at something. So now let's get into some of the body cavities, some other ways that we can divide up the body. We have the dorsal or the posterior cavity. This is going to be where we focus on the nervous system. So the cranial cavity and the spinal cavity. Cranial cavity houses the brain. Spinal cavity houses the spinal cord. And then the ventral or the anterior cavity is going to hold the things that are closer to the front of the chest. So the thoracic cavity, which is going to be divided into two parts, the pleural and the pericardial cavities. Pleural cavity houses the lungs. Pericardial is going to house the heart. And then the abdominopelvic cavity is going to be kind of the rest of our guts, right? The digestive and the reproductive organs. So, where your spleen and your stomach and your pancreas and your intestines and kidneys and all that are going to be found. So let's take a peek at where we see these. So here's our dorsal body cavities. So the vertebral or the spinal cavity and the cranial cavity. We see it towards the back, hence the name dorsal body cavity. And then the thoracic cavity and the abdominal cavity and pelvic cavities are all in that ventral body cavity. They're all towards the front. And we can't see it in this sagittal view or sagittal cut or lateral view. We can see it from the anterior side. We can see the pericardial cavity, right, which is where our heart would be. And then also the top part, the superior mediastinum, right here. If we look at the abdominal cavity or the abdominal regions, we can divide it into 9 different regions or 4 different quadrants. We can use this to talk about where we can find each of the different organs. So like where would you find the stomach, where would you find the intestine, where would you find the liver, right? So let's look at the abdominal regions first. We divide into 9, and so we have, again, left hypochondriac region and right hypochondriac region. Notice right and left are from the perspective of the body, not from our perspective. Epigastric, so epi we think above or on top, gastric we think stomach, so this can be a region that's on top of the stomach. The right and left lumbar regions, down below on the sides. Umbilical region, hey, that's going to be right where you find that belly button. Hypogastric region, right down below, right below that digestive system. And then right and left iliac regions at the bottom corners. We also can divide into 4 quadrants, the right and left upper quadrants and the right and left lower quadrants. We also have some membranes that surround the organs in these body cavities. And so we can talk about the 3 components to these. We have the parietal layer. This is going to be what lines the walls of the body cavity. So this is going to be kind of like on the outer portion. The visceral layer is going to be what lines the organ itself. And then there's a small cavity between these 2 layers. And then we have fluid that is in between these 2. So these layers are not stacked on top of each other in direct contact. The parietal and visceral layers have a buffer zone, right, this cavity between them with serous fluid so that they're not actually touching each other directly. There's 3 different serous cavities that we're going to kind of worry about. We have the pleura. These are going to surround the lungs, the pericardium, which surrounds the heart, and the peritoneum, which is going to be focused on the abdominal cavity or the abdominopelvic cavity. So let's take a peek. So here we see the pericardium in its entirety around the heart, right? We see there's the cavity between that's going to be filled with fluid. And then we have the visceral pericardium. This is going to be the layer that actually is like against the heart itself. And the parietal pericardium, which is on the outside, right? So if we kind of make a comparison, it's almost like if you were to push your fist into a balloon, And so you would have 2 layers of balloon right between your hand and the very most outer space, if you were looking at it here, and the air in between. Now, we don't have air in between, we have a fluid in between. So if you think about it like a water balloon, that might make a little more sense. But these 2 layers don't actually physically touch, right? There's a space between, right? And this is a nice cushioning, right? Nice way to kind of wrap up these organs and provide a little bit extra protection, a little bit extra cushioning for them. All right, the last thing is going to be really short. We're just going to get into some medical imaging. We're going to talk about some X-ray imaging and then some of the modern ways that we can take images in a medical setting and why we would use them. So we're going to really focus just on some of the ways to get images of the body. Some of these are more, I guess you could say, dangerous than others, or require more prep than others, and not all of these are going to be we don't necessarily use these interchangeably. It depends on what we want to look at and why. So we have X-rays. Most people today have had an X-ray at some point. You know, even if you've gone to the dentist, right, you've probably gotten your teeth X-rayed. So that's something that a lot of people have gotten done. Things that people may not have had done are these 3 in the middle: computed technology, or a CT scan, magnetic resonance imaging, or an MRI, and then positron emission tomography, which is a PET scan. And then ultrasonography, that would be like an ultrasound, which you may or may not have had. A good number of people may have had an ultrasound done at some point, but some people may have never experienced it yet. So here's an X-ray. An X-ray is really good at looking at things like bones. It's really good at looking at solid components. So let's say we suspect that someone has a fracture in a bone. X-ray would be an excellent way of seeing that. We could see the break, we could see the skeletal system in detail. But it's not fantastic at soft tissue things. So let's say you get in a car accident and they want to know if you've injured your neck. The X-ray would be great to see if the bones in your neck have been injured, but it wouldn't necessarily tell us if any soft tissue was damaged. Soft tissue would require a different type of imaging. Some of the other ones, right, so these are ones that like a CT and a PET scan actually uses radiation. X-rays do too, but it's not that much. Something like a CT or a PET scan is going to be a little bit more intense, and so there is a bit of a higher risk using those types of medical imaging, but if someone has something like cancer or something serious where it's very important that we get good imaging for it, because we're looking at something that could be very dangerous for someone, we're looking at something that could be severe, we are fine with taking those slight risks or that increase in risk with that type of imaging, because the gain, right, being able to detect where someone's cancerous mass is or something like that is more important, right, or how someone's organ is functioning is more important. MRI, we do not use radiation, we're using magnets. So inside here we actually have magnets that are moving at a very high speed. It's very noisy and kind of claustrophobic, but this is good for soft tissue. So let's say we're looking at someone with a car accident thing again. The X-rays show nothing, so now we want to see if soft tissue has any damage. The MRI would be excellent for detecting that. And then ultrasound just uses sound waves. We kind of send sound waves out and see how they bounce off of the different parts of the body. And so the most common way we would use that is to detect how a baby is doing in the womb.